Hi, my name's Elise and I'm a community nurse, and today I'm going to be talking about managing high output stomas in the community patient. The nurse should meet the following learning objectives by the end of this session. An ileostomy stoma is a surgical opening created by connecting your ileum to your abdominal wall. The ileum is the lower end of your small intestine turned inside out, exposing the inner surface. It's soft and pink like the inside of your cheek, and it is called a stoma. This stoma sits in the right iliac fossa. It looks spouted to prevent stool contents touching the skin, which could cause irritation due to its acidic nature. An ileostomy is known for its liquid stool output because it has yet to thicken in the large colon. A toothpaste-like thickness is the normal consistency. What is normal absorption? Fluid is absorbed in the body from the mouth through to the anus. 90% reabsorption of fluid occurs in the small intestine and only 10% occurs in the large colon. When an ileostomy is formed, the absorption of fluids can stay the same or decrease slightly in the small intestine as above. The small intestine, unlike the large colon below, it is not able to conserve sodium effectively, and the loss of the large bowel function can mean a 1 liter fluid loss. How would I recognize dehydration in an ileostomy patient? The nurse would observe the following from her patient when going out on a home visit. The patient would experience dry, sticky mouth, increased thirst, lightheadedness, or feeling drowsy or dizzy. It's ideal to check for their low blood pressure, sitting or standing, and of course their temperature. Tiredness and fatigue may exist, headaches, passing less urine which is dark or strong smelling, and they may complain of muscle cramps. What is a high output for a stoma? Well, a high output stoma is excessive fluid loss through the stomal bag. It is considered high output if fluid losses are between 1 to 2 liters over 24 to 48 hours. This can result in water, sodium, and magnesium depletion. How can I tell if it's high? Well, measuring stomal output is important for the nurse to gauge the amount of output, and this is done by using a catheter-tip syringe and a kidney dish. The community nurse should encourage the patient and carer to document all input and output of fluids over a couple of days. The nurse also should weigh the patient daily to monitor fluid shifts. Why should I check medications in my stoma patient, you may ask? Well, checking the patient electronic medication management sheet on discharge, this is known as the ELMS, the patient may be taking laxatives, which may cause high stool output. It's ideal to check to see if the patient has recently stopped their pain medication or steroids. Or perhaps they've recently commenced an antiemetic for nausea. Sudden withdrawal of analgesics or steroids or the recommencement of antiemetics can trigger high stomal output. So what medications should the patient avoid? Well, nurses need to advise their patients to avoid slow-release enteric-coated or sugar-coated tablets, and these medications will not be absorbed as these tablets are meant to be dissolved in the large bowel. The patient will tell you that they can see their tablet in the stomal bag undigested. As a nurse, it's important to review medications of concern with the surgical doctor, the pharmacist, or the stomal therapist nurse. It's best to advise your patient to avoid caffeine products and fruit juices, as these will cause osmotic shifts. Avoid drinking at mealtimes, as this also increases bowel transit time, leading to higher output of stool. Advise your patient to avoid artificial sweeteners in cordials, yogurts, gums, lollies, and avoid alcohol and fizzy drinks. These also dehydrate and speed up transit time. What can I do if I have a high output stoma, you ask? Well, advise your patient not to overdrink. 2 liters of water a day is enough. In hot weather, add an extra 1 liter of water. The color of your urine is a great guide to see how well hydrated you are. The patient should aim for clear yellow colored urine. Treat dehydration. Recommend the use of electrolyte fluid replacements such as Hydrolyte, Gastrolyte, Powerade, and coconut water, and also include packet or canned soup. Recommend your patients have small and frequent meals, and hit the white foods. Carbohydrate foods that are high in starch will give energy and thicken stomal output. These include white bread, rice, pasta, potatoes, tapioca, and rice puddings, white marshmallows, firm bananas, smooth peanut butter, and milk arrowroot biscuits. Protein foods can also help with muscle and wound repair. Recommend fish, chicken, meat, eggs, cheese, and dairy products. Fat and high salt foods such as cake and chips will help to increase calories lost and help with sodium reabsorption. These measures should show an improvement of 2 to 3 days. This is a great time to follow up with the patient to see if these changes are working. If the patient is hydrated and the output is decreasing, keep educating and monitoring your patient. If the patient looks dehydrated, fatigued, has signs and symptoms of low blood pressure, is losing weight, and the output remains high, it's time to readmit the patient back to hospital. They will require an IV replacement and a medical review to rule out possibilities of intra-abdominal sepsis, small bowel obstruction, and reoccurrence of IBD. If the stool thickens slightly and the patient has no signs of dehydration, you could recommend psyllium husk, which is a soluble fiber that turns to gel in the stomach. It can help to thicken stool. Psyllium can be found in the supermarket and can be mixed in water or foods. If this does not work, recommend your patient see their GP in regards to prescribing medication, such as antidiarrheal medications called Imodium, Gastrostop, or use of analgesics like codeine can slow gut transit time and improve absorption in the gut. What more can I do? Well, a referral to a dietitian is really important to help those patients manage their low-calorie intake and recent weight loss. Over time, they can have a B12 and folic acid deficiency. Comprehensive multivitamins may be required 1 to 3 times a day, depending on the malabsorption. In summary, recognizing high output stomas in patients allows quick management. To manage a stoma in your patient, recommend hydration using electrolyte replacements, 2 to 3 liters of water a day. White foods and psyllium will help the patient to thicken the output. A multidisciplinary approach can have optimal outcomes for the patient. Doctors, pharmacists, dietitians, and stomal therapists, nurses, referrals are recommended. Thank you for your time.